Most families and couples believe that when they fail to conceive a child, the blame lies solely with the woman. However, this is simply not true. Most men are actually contributing factors to infertility, and the single most common cause of male infertility is low sperm count. In this video, we are going to break down exactly what low sperm count means, the home remedies you can use to fix it, and the medical treatments that can restore happiness to your family. I am Dr. Ava. Today, we are learning medicine in the comfort of your living room. We are going to tackle this very specific issue called low sperm count. First, we must understand what sperm is. It is a man's reproductive cell, responsible for fertilizing the egg so a woman can get pregnant. If these cells are not present or healthy, conception cannot happen. My advice to every couple struggling to conceive is to stop looking only at female factors. A man should go and analyze his sperm immediately. Through a test called a semen analysis, you can determine if you are viable or if you need medical intervention. Understanding your results, the vital numbers. When you receive your lab report, there are specific parameters you need to understand. First is volume. When a man ejaculates, the volume should be between 1.5 to 7.6 milliliters. If the volume is below 1.5, we start putting question marks on your fertility. Next is the total count. In a single release, a man should ideally release between 39 to 928 million sperm cells. Men are biologically very rich in this regard. If your total count is less than 39 million, or if you have fewer than 15 million cells per milliliter, you are dealing with a low sperm count. But quantity is not everything. We also look at motility, which is the speed and movement of the cells. These cells must swim very fast through the cervix and uterus to reach the fallopian tubes. We look for progressive motility, where cells move in a straight line like a swarm of bees. This should be between 32 to 75%. Then there is vitality. This measures the number of live cells. If you are firing bullets that are not live, you will achieve nothing. Your live cell count should be greater than 58%. Anything below that is considered abnormal. The perfect anatomy of a sperm. A normal sperm cell must have 3 distinct parts: the head, the midpiece, and the tail. Morphologically, if any of these parts are missing or misshapen, the cell cannot perform fertilization. The head should be oval, much like an egg, with a length of about 5.6 micrometers. If the head is too large, it cannot penetrate the barrier of the female egg. The midpiece should be thinner than the head. The tail must be the thinnest part of all. The tail should be at least 45 micrometers long to act as the motor that drives the head toward its target. If it is too short or too long, the sperm will struggle to reach the egg in time. Top medical causes of low sperm count. Bacterial infections are the #1 cause of poor production. Infections like E. coli, streptococcus, or staphylococcus can affect the testes and lead to low sperm production. Autoimmune disorders can also play a role. Some men have defense cells or white blood cells that mistakenly attack their own sperm, treating them as foreign invaders. Retrograde ejaculation is another cause. This occurs when semen enters the bladder instead of emerging through the urethra during orgasm. Hormonal imbalance is also critical. Men need a balance of testosterone and follicle-stimulating hormone for sperm maturation. If these are low, production stalls. Certain medications can contribute. Blood pressure medications called beta blockers, such as propranolol, bisoprolol, or atenolol, can have a side effect of lowering your sperm count. Diabetes is another important factor. This condition can suppress the production of testosterone, which is the primary fuel for manufacturing sperm. I want to pause and speak to the men watching this who are truly intentional about change. If you have been struggling in silence or feeling the weight of this challenge on your shoulders, I want you to know that you are not alone. Taking the step to educate yourself today shows that you are serious about your health and your future family. Before we continue, if you have found this guide on improving sperm count and male fertility helpful so far, consider liking the video, subscribing to the channel, and sharing it with someone who may be silently struggling with fertility issues. I encourage you to stay focused and watch this video until the very end. The home remedies and lifestyle shifts we are about to discuss are the foundation of your recovery. Your journey to vitality starts with these next few steps. Lifestyle killers, saunas, and weight. There are social and lifestyle habits that silently kill your sperm count. Overheating is a major factor. Frequent hot baths, saunas, and steam rooms raise the temperature of the testicles. Since sperm need a cool environment to survive, this heat effectively kills them. Obesity is another risk. Excess weight interferes with testosterone production, leading to a lower count. Furthermore, The use of alcohol, tobacco, and marijuana has been shown to be a significant risk factor for male infertility. Even chronic stress and depression can trigger biological shifts that lower your reproductive health. Medical treatments and breakthroughs. If the cause is bacterial, the primary treatment is a course of antibiotics. If the issue is hormonal, we use hormone replacement therapy. This can include medications like clomiphene, which can be just as effective for men as it is for women. Another option is surgery. This is specifically for those with varicose veins in the scrotum. These enlarged veins increase blood flow and heat, effectively cooking the sperm. Surgery can redirect that blood flow and cool the area down. There is also research regarding a supplement called Mannix. It has been shown in some studies to increase sperm motility by 124% and improve vitality fourfold when taken for 3 months. Natural home remedies for fertility. Timing intercourse is essential. Focus your efforts on the exact day of your partner's ovulation to maximize the chances for the sperm you do have. Avoid lubricants. Many commercial lubricants negatively affect the motility and vitality of your cells. Change your clothing. Avoid tight pants that trap heat. Switch to loose cotton boxers to allow for better air circulation and cooler temperatures. Focus on nutrition. Eat foods rich in vitamins C, D, and E. These specific vitamins have been scientifically linked to higher sperm production. Increase frequency. Having sexual intercourse more frequently can increase the total number of chances for successful fertilization, even if your individual count is low. If you are ready to take control of your fertility, start by making these lifestyle changes today. Knowledge is your best tool for overcoming these obstacles. If you found this guide helpful, make sure to subscribe to the channel for more health insights. If you have questions about your specific situation, leave a comment below. Don't forget to like the video. I'm Dr. Ava, and I am here to help you find the answers you need. Take care of yourself because you are worth the effort. See you in the next video.